You're listening to Fast Facts, Ask the Expert with Tom Viola, brought to you in part by a Coral Dry Mouth Spray. Stay tuned after the episode to hear a special message designed to help you treat your patients even better.
Welcome back, everyone, to Fast Facts, Ask the Expert with Tom Viola. Tom, welcome back.
Live from Chicago. Thank you so much.
Live from Chicago. It's Saturday. Oh,
yes.
That's different. That's the first city, not the second city. Tom, I am very grateful that you're here, but as always, I kind of have maybe a stumper for you. Dry mouth, xerostomia. Should we be treating patients that have maybe more of a moderate or severe case of dry mouth differently than we would a mild case?
Absolutely. I will tell you that a lot of people think they have a mild case of xerostomia because it's hard for them to judge how dry their mouth is, how much xerostomia they have, what the level of xerostomia is. But I would say we treat moderate to severe dry mouth much more aggressively because, again, we know that's going to lead ultimately to much more tooth loss, much more decay, and much more overall decrease in quality of life because you can't chew, you can't speak, can't swallow. So all those things add up to us using more than what you find as an over-the-counter product like, water-based rinses and so on. Because first of all, they're inconvenient. I mean, where do you spit after you rinse, right? And then also they don't really work as well for moderate to severe cases. For a moderate to severe case, you need something that's more lipid-based, that's going to lubricate the mouth and at the same time lock moisture in. And in that case, you need something like a prescription item like a Coral oral spray because that will provide that lubrication as well as that moisture retention that you're looking for. And that reverses time. All of a sudden, your mouth isn't so dry. Now you can speak clearly, you can form words, you can chew, you can swallow. And as we said, on other occasions, when it comes to having a dry mouth and not being able to eat, speak, swallow, you tend to be socially isolated. Now you're not. Now, you're back into integrating and working with other people. And honestly, I think that makes the world a difference for everyone when you've got a dry mouth, because if you don't know how dry your mouth is, it's probably dry enough that you need a treatment like a Coral. I don't think there is a case of mild xerostomia. I think mild xerostomia is really moderate xerostomia, and then it goes from there to severe.
Yeah. I think the hygienists have a pretty important role in that, in helping them identify, because even before the patient thinks that, they think it's mild, but we know it's moderate or severe, but maybe we can identify it maybe as, kind of seeing them earlier.
It's always the hygienist that makes that ultimate discovery before the patient does in so many venues. So it's gastrointestinal disease, respiratory disease, cardiovascular disease. The hygienist is always the one sometimes that comes up with the diagnosis, if you will, first, and mentions it to the patient saying, hey, when's the last time you saw your doc about this? I mean, that's what makes hygienists so wonderful, because not only do they do what they do every day, but they save lives. They save people from themselves, because people don't always make the best choices. And in this case, if I think my mouth's kind of dry, the hygienist is going to be one to tell me, no, your mouth is really dry. I'm starting to see the effects in your teeth. Let's get this treated.
I love it. Tom, thank you very much for being on. If someone wanted to reach out and ask a more detailed question about this topic, how may they find you?
Tom at tomviola.com anytime, or on social media everywhere at Pharmacology Declassified.
Thanks, Tom.
Thanks, Andrew.
Thanks for listening to this week's Fast Facts, Ask the Experts, brought to you in partnership with a Coral Dry Mouth Spray. Our patients don't just have a dry mouth, they have dry mouth, xerostomia, and they need a real solution to help them. A Coral spray is lipid-based, which means long-lasting protective coating on the oral mucosa that helps retain moisture. 2 quick sprays can relieve the effects for 4 to 6 hours. If you want to learn more, head over to their site, acoralspray.com, or check out the show notes of this episode for a link and a QR code. Thanks for listening.